Okay, so when you line up a patient and you have a partner, you're going to trade off. Whoever's driving has the pendant. That person will line up to their mark on the laser 100%. We're going to this little plus looking sign. Okay? You're going to go 100% on. The person on the opposite side probably won't even be touching their mark. For argument's sake, let's say your partner has gone 100% on the other side. Now, you need to move the patient to get them from here to here. The mark moves to the laser. The patient actually moves. You're going to laugh. Some people try to move the opposite. They try to move the patient such that the laser moves toward the mark. It's never going to work that way. The patient itself needs to move toward the mark. Now, let's just oversimplify this. Let's say your partner is on the other side. Your partner has been driving. You look over here and you see, there's my mark, there's where I'm going to. You want to move halfway toward this mark. Let's make it even simpler. We only have an up-down move to go here. We want to move here to here. So you want to move your patient halfway. Why do you say halfway? Because if you move yourself halfway on, that moves your partner halfway off. Okay? If you both go 100% on every time, you're going to fight each other. He's on over here. She tries to move completely on this side. You're going to go back and forth. So whoever's driving moves their mark until they're exactly on the laser. The person who actually rolls the patient goes halfway to the mark. Now, my mannequin doesn't roll very well, but I'm going to show you how to do that. The patient actually needs to roll up. You're going to grab the sheet underneath the patient, put your hand on the patient on the other side, okay? Be sure not to grab anything sensitive, especially gentlemen. Don't get anywhere near sensitive bits on the ladies, okay? If you have to, just put your hand kind of on the bottom of their chest. You need to be able to feel the patient roll, okay? You need to feel that anatomy go where you want it to go. If you just pull up on the sheet, what that's going to do is kind of scoot the patient towards you, but it's not actually going to give you much of a roll. You need to pull the sheet, have your hand on the opposite side, and actually roll the patient. Okay? You want to actually move the patient in this direction. You don't want to just lift up. You don't want to pull away. You want to roll. Okay? So let's pretend that we went halfway. That would move the patient to about right there. That means that your partner is now halfway off. They're going to then drive back on. Let's pretend that I'm the driver now. I'm going to go 100% on. And then you tell your patient, I'm on. Then he or she will then roll halfway again. Whether it's up, down, in, out, left, right, you're going to move that mark halfway to the laser. Okay? So this is something you need to practice quite a bit. Driver, 100% on. Mover goes halfway to where they're going. Once everyone is on both sides, then you're going to move on the anterior left, right, and in, out to the anterior mark. There's some instances where you're going to go left, right only, some instances where you're going to go in, out, and left, right. We'll cover that at a later time. But remember, laser is stationary. Patient moves to the laser. That's very important to remember. It's something you're going to be surprised. 1 or 2 people a year do get that mixed up at first. It doesn't sound like something you should mix up, but sometimes it happens. With practice, you'll get it.